Everyone loves the aesthetics and beauty industry, but you never get to see everything behind the scenes. It's for authorized personnel only. But now you're being
Blow the dice for me. Put your pretty ass lips together, blow real nice for me. Yeah, I'm trying to hit a lick and slide to the dealership in the morning. Papa need a brand new phone. Hot head, they not gonna believe it, but check the recording. Touch that, up a few back. Big booty hoes with me in the pit. Bar full of liquor, cash for the strippers. It's gonna get weird tonight, so no pictures. Some money to blow. I'm about to buy Las Vegas after this roll. I'm about to buy Las Roll. Come on, 7, 7, 7. Let's go. Yes, Lord.
really happy to have you here today. I've got a great panel of guests, and this is such an important topic. This is something that everyone really needs to be thinking about. If you've ever thought about having any kind of cosmetic procedure, treatment, anything, you got to keep yourself safe. And this is something that's really near and dear to my heart. A lot of what I do has to do with patient safety. It's one of the whole reasons we started launching Naked Beauty, and a lot of what I do in my practice is centered around patient safety. You guys may know that I did a show with Lifetime called My Killer Body. It was hosted by Kay Michelle. If you haven't checked out the show, on that show we were able to help a lot of people that didn't have the best experience with cosmetic surgery and procedures, and I had the privilege to try and help them get better. It was a really great experience. If you haven't seen the show, you should check it out at Lifetime. There have been a lot of crazy things happening in the news that are just perfect lead-ins for what we're going to talk about today. There's so many things that happen. You hear about these terrible disasters. There's a recent story of a woman that went to Turkey. Her name is Kaydel Brown. Now, Kaydel went to Turkey to have cosmetic surgery from the United Kingdom. She left Britain and went to Turkey to have her procedures, and she went with her sister. And well, it didn't go well. They were supposed to have surgery on the same day. Kaydel, she was the first one of the two sisters to go under the knife, and unfortunately, she never made it out of the operating room. And the story gets really crazy. You can check out more of the details in my Instagram at Dr. Rubenstein. It's just a really upsetting thing, and it's one of those things where maybe that wasn't the greatest idea. Now, the sister, of course, never had her surgery, but she flew back with Kaydel's body, and there were, let's just say there were some things missing that shouldn't have been missing. And you can check out the story. It's really a crazy story. There's also a recent story that highlights another thing you have to think about, vetting your doctors. There's a story in the news recently about a doctor in Los Angeles practicing plastic surgery without a license. Now, this guy, Dr. Christian Perez La Torre, he didn't have a license to practice medicine, let alone to open up a practice and be doing surgery on people. Operated on someone, had a complication, operated to fix the complication. A month later, had to operate again to fix the complication. Finally, the Medical Board of California got a hold of it, but it should never have gotten that far. You should never, really, no one should be in that position for a doctor, never mind board certification, training, all that jazz. At a bare minimum, you ought to be a licensed doctor, right? You ought to have a license to practice medicine if you're going to take care of people. No, we see this stuff all the time, and today is World Patient Safety Day. So it's the best day to have this conversation. It's the best day to have this show, and I've got a lot to talk about here. So, one of the things we think about in patient safety is, what's acceptable? What is the actual risk of procedures? And there's been a lot of controversy with that. In general, the chances of a mortality, dying in surgery, should be 1 in 50 to 100,000. It sounds kind of weird to say the acceptable mortality rate, but listen, surgery is risky. It's not like getting your hair done. Please take it seriously if you're thinking about having something done. With the risk of surgery and all the operations, the hundreds of thousands of operations that are done all the time in this country and worldwide, we have a pretty good idea of when things go wrong, how often should that happen. And it works out to be about 1 in every 50 to 100,000 operations, that you would have an actual mortality. And it's a tragedy no matter when it happens, but that is the rate that we would expect. And also varies a little bit depending on where you're having it done and what percentage is being done. Now, interestingly, office-based surgery, like where I do all of my surgery right here, office-based surgery has about a half the rate of mortality that it does in hospitals. And that actually makes sense. Hospitals have more bacteria, more resistant bacteria around, there's a lot more people involved, and you would think big operating room, big facility, and you're safer there. Well, not always. So the statistics bear out that you're about half the risk in an office-based surgery center than you are in a hospital. And an ambulatory surgery center is somewhere in the middle. The different operations that you do will also have different risk rates. Tummy tuck is about 1 to 10 to 15,000 in terms of mortality. Liposuction is 1 in 40,000. People think liposuction is so risky. Actually, it's one of the safest operations that we do, because it really, when done properly with good technique, it's extremely safe. It's not a lot that can go wrong. You really should never have big complications with this operation. Now, one of the things that has gotten a lot of controversy and a lot of attention in the news has been BBLs, Brazilian butt lifts. This is an operation where you take the fat out, doing suctioning in different areas of the body, typically your tummy, your sides, your love handles, and then using that fat and putting it into the butt to make it rounder, fuller. That is a great operation, but it had a lot of controversy and it was associated with a lot of deaths. Many years ago, there was a string of deaths, unfortunately, down here in Florida, in Miami specifically. There have been a lot of deaths over the years associated with BBLs. And that led to people believing certain statistics that were a little flawed, that the deaths were about 1 in 3,000. Now, if the acceptable mortality rate is 1 in 50,000 to 100,000, and you've got a procedure where it's 1 in 3,000, that sets off all kinds of alarms, and you should be worried about that. But the truth is, it actually turns out that it's closer to tummy tucks. It's about the same risk, about 1 in 10 to 15,000. So there is, this is a great time for me to introduce my first guest. I want to introduce Dr. Pat Pazmiño. Dr. Pazmiño is one of my colleagues here in Miami, and he is at the forefront of investigating all of those BBL deaths years ago. He's actually been in the autopsies and seen the dissections, has seen the fat as it's been dissected out and found in the big veins in the body, understanding exactly how people have died. Let's bring Dr. Pazmiño into the mix. He is recognized internationally as an expert in BBLs, particularly recently publishing a lot on BBL safety. In fact, one of his publications recently won the Tiffany Award. The Tiffany Award given by the Aesthetic Society in recognition of his tremendous work on keeping people safe with BBLs and really being right there every time to help guide everyone else, to help keep us all getting the best results we can in the safest manner. So, Pat, thanks for joining me today. Really happy to have you on the show. Now, before we get into this, it's a serious subject, but I want to start off a little bit lighter. I got a bone to pick with you, dude. I have been calling you Pazmino. Everyone calls you Pazmino. And I just, in preparing for the show, saw the tilde above the N on your own website. So how is it you don't tell me it's Pazmiño after like 20 years of talking to you?
I'm sorry, that's my bad. But I mean, thank you so much for recognizing that. Many people think that's a smudge, or they don't realize that in the Spanish alphabet we have 3 extra letters that don't exist in the English alphabet. But thank you. I'm happy to answer any.
You know I'm Cuban, so
yes.
All right, well, let's get back on topic here. Your work with BBLs is really, in our world, is legendary. You're probably the king of BBL safety. And talk to us a little bit about your experience going through those autopsies. I mean, what a tremendous thing to jump in and volunteer your time and work to really understand this. How did you get into that opportunity, to really get involved that deeply in this problem? And what did you see when you were there looking at those autopsies after tragic deaths?
Well, thank you, Adam. And it was an honor to be involved. And it was just about being in the wrong place at the right time. And as you know, living here in Miami, This is a mecca of body contouring, of liposuction, fat transfer, tummy tucks, all these things. And we have people from all over the world coming to Miami to go ahead and have these procedures. It was extremely popular, but also we had the most deaths, the most problems. And I really think that it's a testament to our training as plastic surgeons because it was described to me in residency that plastic surgery is the study of the skin and all its contents. And what's amazing about plastic surgery is that it continues to evolve, it continues to change because 18, 20 years ago, there was no such thing as a BBL. And this has been the most popular procedure over the last 5 years in body contouring. So when this started happening in our community, we started noticing that all these deaths were happening. And the most important thing is that it was a very unusual death because I think you laid it out very, very well that there's always risk in any surgery, in tummy tucks, in facelifts, in breast augmentation. But the general risks are pain, for example, or infection, or skin breakdown. And what was interesting about the BBL is that these patients, they were actually dying from something unique, which was called a pulmonary fat embolism. And essentially, what that means is that in the right after the procedure, patients were dying because their lungs were being filled up with fat. And this was something that we had not seen before. So it was a unique opportunity. The doctors that work in the morgue, they're our colleagues. They went ahead and they reached out to us, and they wanted some expertise in an area that they normally did not go into, which was the muscles of the butt. So we were able to go ahead and witness a lot of these autopsies and see the dissections and really go down to the nitty gritty and look at what was happening inside. So the concept was that these people were dying from fat entering their lungs. So that's where the bullet entered, and well, that's where the bullet killed the patient. But our question was, how did the bullet get into the body? And that's why we started looking into the butt, because we wanted to understand how this was happening, how the fat was getting into the bloodstream to cause these fatalities. Can you hear me now? Okay. I can't hear Adam either, but um, Adam, I don't know if I can't hear you right now. I don't know if anyone else can hear me. Kia, I can hear you. Yes. Okay. I think on the live, it looks like I'm still talking, which doesn't surprise me. I think there's a couple second delay here. Yeah.
Into the one shot. You have me back up?
Have Pat keep talking.
Huh?
Have Pat keep talking.
Yeah.
Pat's talking fine, right?
Yeah, but I can't have him keep talking. So just go to. This is bizarre. This is weird, guys. Get it? Just we're gonna switch the mic. We're gonna switch the mics out. This is weird. Here's the problem. Here, you have me? Okay,
Adam,
you
should I
guys-
keep going? I
You
think.
can,
I
you
think
can keep going, Pat.
okay. Perfect.
Okay, but do you guys hear me? Now
Yes.
you guys hear me. Oh my God. Oh, Angel, we had some sort of mic malfunction, but we're back. So Pat, you were
Yes.
there. You saw the fat actually in the big vessels, right? You saw the fat into the muscles. So that's really how we learned where the danger is.
That's true. Absolutely.
So, in your mind, and what we've learned because of the work that you did, along with Dr. Garcia, Oni Garcia, together with a bunch of other guys here, we learned that you can't put the fat into the muscle. That is the problem.
That's exactly right. Because what was happening is that what we learned about this problem is that two events have to happen in order for a patient to die from a BBL. So, number one, there has to be injury to a blood vessel. And that injury to the blood vessel, that is the window that opens the vascular system, and then that's where fat enters. So that's the first thing that has to happen. The second thing that has to happen is that there has to be fat into the muscle, into the gluteal muscle, into the muscle of the butt. Now, the interesting thing about the muscles of the butt is that they are very dense with blood vessels. And there is no way to avoid every single blood vessel in the muscle of the butt. So when you do this procedure, because you cannot avoid the blood vessel, you just have to stay out of there. So the gluteal muscle, it's like a very bad neighborhood that if you drive through a bad neighborhood, it's possible you could get carjacked. The only way to avoid getting carjacked, the only way to avoid something bad happening to you is to avoid the neighborhood completely. So that's what our
But that neighborhood starts deep in the muscle. I mean, if you're staying above the muscle, as we've learned, then your risk is nearly zero for that particular problem.
That's exactly right. Yes.
So, for those of you who are watching, the what we're talking about is the places you place the fat, and every surgeon should know this by now because this has been around for a long time. This is not that new an idea, but it was revolutionary at the time we finally discovered, okay, this is how this is happening. And since then, Pat, what was that, 2, 3 years ago? When was the time that we first put out the recommendations?
The 2018.
Hey,
So
wow, God, it
yeah,
feels like just yesterday. It's already been
yes,
6 years, and it's such a
yeah,
long time. So, for the last 6 years, we know that you've got to stay on top of the muscle. The idea of muscle into the muscle is a bad because you inevitably are going to get under into deeper tissues, cause damage you don't want to cause, and put fat where you don't want to put it. So we've known that for a while, and Dr. Pesmino was one of a small group of people that got together and made these recommendations. So today, now 6 years later, everybody knows this, and the vast majority of surgeons, certainly anyone who's is staying away from that bad neighborhood, and we know this because it's been put out. Now the one of the great ways that we help keep patients safe is by getting that information out there, and the way that the information has been disseminated most effectively has been through our societies, like the Aesthetics Society. I want to bring on my next guest, Dr. Kia Movasagi. Dr. Movasagi is a tremendous figure, recently named the president of the Aesthetic Society. The Aesthetic Society is a group of plastic surgeons, all board certified, all specializing in cosmetic surgery. And Dr. Movasagi has also recently published a book as the editor of the book Shaping the Breast. He's an expert in breast surgery all over the face, breast, and body. I want to thank my good friend Dr. Movasagi for coming on the show. Kia, welcome to Naked Beauty.
Adam, thank you for joining you today. It's an honor to be here with my good friend, also Pat, who helps me on the board. As you said, this today is the safety day, and what a day to talk about some of the safety issues that you and Pat already highlighted, and some of the things that we do at the society level to advance the most important cause in practicing aesthetic medicine and surgery is advancing patient safety. So we are all in this to improve patient outcome and safety.
Yeah, well, obviously, at the end of the day, we're all looking to have the best outcomes for all of our patients. That's our number one priority universally. All the members of the Aesthetic Society, all the plastic surgeons throughout the country are thinking that. So, the Aesthetic Society for me has always been a tremendous resource, not only for knowledge and learning these kind of things, but disseminating that knowledge, for investigating and learning these new things. There's a lot of efforts that the Aesthetic Society has done to And it's also a great resource for patients. And we should talk a little bit about what patients need to look for, because there's so many things that are important to think about choosing a plastic surgeon. And the Aesthetic Society is where I always recommend people to go when they're low for a plastic surgeon, knowing that every member is board certified. We all specialize in cosmetic surgery. You know you're going to have a good doctor, and he or she is going to know what they're doing, have the proper education, the proper ethics, and be driven by patient safety. So talk to us about what, if someone from the public is watching this, someone that's thinking about having cosmetic surgery, goes to the Aesthetic Society as a resource, what are they going to find?
Well, you're going to find a list of all the doctors who are a member of the society. And as you said, these folks go through a process of being scrutinized. So we look at their background, we look at their ethics, we look at any potential legal actions against them, we look at the board certification. All of those things goes into our decision making when we select somebody as the member. And then lastly, once the committee decides that yes, they're fit for the membership, we still put it out there to our members and ask the members if they have any concerns about this, the folks becoming a member of the society. So for us, we want to make sure that we represent the most trained and highly ethical folks to practice the aesthetic medicine and surgery.
Yeah, it's important that people understand that being a member of the Aesthetic Society is not a given. You really have to go through a pretty stringent process. You have to have a certain amount of experience in surgery for a period of time. You must be board certified. And even then, you submit this application to the society, and you're vetted. Not only are you vetted for your experience, you're also vetted for your ethics. You take a look at your advertising material. People are not making crazy claims. We're trying to keep everything truthful and honest and above board, making sure that people know what they're getting into. And all of that plays into becoming an Aesthetic Society member. So it is so valuable. People really need to take advantage of it. You know, the aesthetics.org is a huge resource for people. Let's get into it now. We've got all you guys here. Let's talk about some of the issues. I've got a list of some issues. If there's things you guys want to talk about, and by the way, for those of you who are watching, if you want to DM questions, my producer Tucker is watching the DMs. We're going to be keeping a list of as they come up. We're going to be shooting them into the panel here. So from this point forward, we're going to be a panel just talking about the. Let's start it off that me and Pat know a lot about. I don't think you have this in your neck of the woods, Kia, but chop shops. And I'm not about places where they take cars apart, right? This is a huge problem in Miami, huge. And I've seen it start to spread across the country. These are places that are, it's sort of the Walmart model of plastic surgery, high volume, low cost, but even worse than Walmart, almost no regard for safety and quality. It's all about how fast can we churn out cases, and how, if we're charging such low prices, we got to do 10 cases instead of 2 just to make the same amount of money. So it's all about speed and efficiency and how many people can we get to sign up. And it's a bad model. We have a lot of this here. I mean,
we can't hear you, Adam.
Got cut.
I think the audio got cut, at least the last part.
the mics are dropping.
All right, you should be back.
We're back. Can you hear me, guys?
For broadcast, not for them. Hang on.
Ah,
It's two
okay.
separate settings.
Get it onto them. All right, we just got it. It's coming up now.
Road. No road.
Are you back on?
Let me try something else.
I don't know why this is happening, but let's just get it back on so everyone can hear. Are you hearing me on the? No? They're not hearing me on the broadcast either.
I turned on the MacBook Pro microphone, so hopefully they can hear you.
Which mic are you running on?
I'm running the Rode, but the Rode's not showing up on. Ninja.
Okay, then plug the other one back in. And what did you unplug to get me back in? God, this is terrible. This is why we're going to run through the board next time. All right, you have the mic back up? This is so distressing. Tucker, stay here. We need you in this room so you get questions. We can have you bring them up.
Can they hear you?
You guys hear me? Am I back up?
Yes.
Okay, I am sorry. This is the joys of doing live broadcasts, but there you go. Joe, in the meantime, let's just keep both mics in, see if you can have both mics as an asset. Keep one muted so we can flip if it happens again. All right, well, so what I was saying is these chop shops, Pat, I see patients from them all the time. It's a real problem. Give me your perspective on chop shops.
Sure.
You know, we have the same problem here. I practice in Oregon, and we are seeing the same thing you guys are seeing. I have patients who go to consultation. The problem is, you know, these places don't even have a surgeon or a doctor seeing the patient. They go and see a quote-unquote consultant. The consultant is a business person. They don't even understand the anatomy. They don't understand analysis and diagnosis and treatment planning. And then they get a code, and then they meet a doctor or surgeon on the day of the procedure, and then they will not see the same doctor the next day for follow-up. And then when they get a complication, they show up in our offices to fix it.
Well, hold on, Kia. They're not seeing the same doctor. They're not seeing a doctor for follow-up, because in most of these places, the doctors are doing one thing, and that's operating full-time. So there is no doctor seeing these patients before or after surgery. I mean, Pat, you see this.
Absolutely. And I mean, again, you know, I think that patients, they need to understand a couple things. That number one, all of us love saving money, and we all look for opportunities, especially in this economy. But the cheapest surgery is the right surgery done the right way the first time.
That's right.
And so it's not just about going ahead and saving money. Always protect yourself. And I think what happens in these centers is that many times the patients truly don't know what's going on in these centers. And we've heard reports from National Geographic and other sources that the doctors are actually not doing the surgery. So
right, and that's even worse, right? The doctor that you're meeting at the bedside. So just, I mean, for those of you who are watching, maybe you've never heard of this before. It's a real thing that we see in Miami all the time. And what happens typically, as Dr. Mubasagi and Dr. Pasmini are explaining, you show up. Actually, you don't even show up. You usually email, and you email saying, "Hey, I think I want to have a tummy tuck," and they schedule you for a virtual consultation. Now, sometimes they're actually asking for photos of you, but not always. They just want to know what you want to have done and book it and go. But if they get the photos, typically a doctor's not looking at them. It's a salesperson that has no medical training whatsoever and just knows, okay, yeah, it looks like you got some extra skin in your tummy. Okay, tummy tuck sounds good. You look a little pudgy, probably some liposuction too. And you know, that's the thought process. And then that, if you say, okay, sounds good to me, they give you a price. The price is usually very cheap. You say, what a great deal, I'm in. And you sign up, you fly to Miami, show up on the day of surgery, and that's when you're meeting the person that's supposed to be your doctor. I mean, someone pops up next to your bed as you're waiting there to go to surgery, and he or she says, hi, you know, I'm your doctor. Sort of, I always joke about it as though it's like going to a restaurant, and you sit down in a new restaurant for the first time, and the waiter comes over and says, hi, I'm John, I'll be your waiter today. I mean, is that really the relationship you want to have with the person that's going to be cutting you open and trying to rearrange parts of your body? Probably not. So this, and Key, you talk about them being, not seeing the doctor, a different doctor afterwards. They're lucky if they see a doctor afterwards, because most of the time it's people with the same qualifications as the salesperson that sold them the surgery. It's just someone. Maybe it's a medical assistant, maybe it's a nurse if they're lucky, but rarely is it ever a doctor. But now, you know, Pat, you're talking about it being the cheapest surgery because it's done right the first time. The reason we get into that discussion is because people are looking for the cheapest price, right? And that's why they go to these places. But it is costly to have things redone, right? You must see patients coming from some of the local chop shops.
We do, and and it's not just about the money. I mean, it's about because what happens is that I realize that my patients are not just women; they're mothers, and taking care of a mother really is an honor because I mean, when you're taking care of a mother, you're really taking care of 4 or 5 people at the same time because the mother is the heart of the family. So what I tell patients is, trust your doctor, but verify. And I think something important to, for patients to go ahead and do is when they talk to a doctor, ask them, okay, I understand that you want to go ahead and do this procedure on me. The patient should ask the doctor, please give me the phone number of the hospital that will let you do the same procedure on me, because these things can be complicated, and sometimes some of the doctors that work at these clinics, they try to confuse patients. They come up with board certifications on boards that don't exist, that are
Right.
not real boards, and patients, unfortunately, they don't know the difference, but hospitals do. They can't trick a hospital. So we often tell the patient, just ask the doctor, please give me the name of the hospital that would let you do the same procedure that you plan to do in the office.
Yeah,
And
great question. Actually, I would ask the doctor, listen, I think I might want to have this done in a hospital. What hospital
sure,
can we go to have this done? And just ask them, where do you operate? Where can I have this
yeah,
done? And put them on the spot that way.
yeah.
It's a,
Because
that's
as
a
Adam
great
said,
question.
it is safe to go ahead and do this in the office OR, but make sure that you are working with a real qualified professional. And
Yeah.
this is a big problem in Florida. Just a little while ago, there was a PA arrested up in northern Florida, and he was operating without a medical license,
Yeah,
and
no
so
supervision.
no supervision, no doctor in the vicinity. And so these things happen. So patients, it's wonderful, the doctor patient relationship. It's all based on trust. Trust your doctor, but verify what they're telling you.
Did you ever serve in the military? That's the military credo, right? Trust but verify.
I didn't have that honor, no, unfortunately.
Uh, Kia, as the president of the Aesthetic Society, this is an American society with American doctors. We always recommend that people stay in the country, stay actually even close to home, so you have your support network around, you have people that can help you in your recovery. It's probably the safest place to go to have your surgery, is where you have help if you need it. But what comes up a lot, especially in Miami as an international destination and a portal to get to other countries, is that people frequently leave the country to have these things done. That's another big problem of patient safety. What is your view on? I mean, because certainly we know we have members internationally, right? We have international members in the Aesthetic Society that are terrific surgeons, all qualified to do the sort of things that we do here. So let's talk a little bit about leaving the country or not leaving the country for cosmetic procedures.
You just bring up a good point. When we talk about a lot of times cost saving, we should be talking about the life saving. To me, that's the most important saving that we should do. So, and if it's something that you're doing that involves your well-being, I mean, you have to think twice about who you want to be touching you and doing procedures on you. Who's going to put you to sleep? Is an anesthesiologist going to put you to sleep? Who's going to be taking care of you during the surgery? All those things are important. Then, once you're done with the surgery, you have to ask yourself, okay, the surgeries, as you mentioned, Adam, earlier, surgeries are surgeries. They have complications. You went over the statistics of, what we call morbidity and mortality, complications, infection, bleeding, that kind of stuff. And then you could have complications later on. Who will be taking care of you if you were to have that operation? The body is not going to know the difference whether you had a cosmetic surgery that you paid for out of pocket or you had a medical surgery that the insurance covered. Either way, your body is going to heal the same way and it's going to have the same problems. So ask yourself that question. If I get that complication 2 weeks after surgery, I just saw a patient the other day, 2 weeks from Mexico, and now she's had a bad, nasty infection. Now I got admitted to the hospital here, has no access to the doctor who did the operation in the first place. Now they're calling us. I have no idea what took place. It's kind of a major crisis. So ask yourself, who is going to take care of your doctor? And when you leave that destination coming back home, is that long enough time? I see patients come back after major surgery a week later. I see the other day I was coming back from Istanbul. I saw a lady hunched over. I could tell she had a tummy tuck in Istanbul in the airport. I'm like, okay, that's when you're asking for trouble. That's when you gotta get blood clots. That's you're gonna get blood clot going to your lungs and potentially kill you. So those are the things people need to ask before they go on these journeys.
And people are very cavalier about it. Did you guys see the story of the couple that boarded the American Airlines plane and had to be asked to leave the plane because it was disturbing other passengers? The guy had just come from having a hair transplant, was not covered in the head, had blood dripping down the forehead. Uh, Crazy things that are happening with people leaving the country, coming back. And we spoke about, in the opening of the show, I spoke about Cadell Brown, who died coming from the UK to go to Turkey. So it's certainly, you talk about bargains, and you talk about pricing and trying to get the best price, but the biggest price you can pay is your life. So that we definitely have to keep clean. So while you may find excellent surgeons in other countries, make sure that you're spending enough time to recover so you come home safely. Make sure you have enough support around you. Leaving the country for surgery is not always advisable. One of the biggest crazes that we see now is the GLP-1s, the weight loss drugs, Ozempic and Mounjaro and semaglutide, tirzepatide. We see this a lot more in patients. It seems like 10 or 20%, maybe more, of my patients are on it. What is the recommendation? How do you guys feel about operating on someone using these weight loss drugs?
I think this is what we call the Ozempic era. It's not just about what the consequences of massive weight loss, but you also have to take into account what happens with their system. How does your drugs work? And they work by slowing down your system, the way from your mouth all the way down to your bottom. It slows down that process. So the problem is, especially if you're going to go sleep, the anesthesiologists always have the concern that if your stuff sits in your stomach, you could have a problem, what we call aspiration. You can throw up the material and it goes in your lungs, and that could potentially kill you. So it's very important, if you're on any of these drugs, that you communicate that with your surgeon, and the surgeon communicates that with the anesthesiologist, and know exactly when to stop those drugs so that you don't have suffer from those side effects. The other side of the story also is with these drugs, there is an element of malnutrition, because if your system stops not going through your system, you're not absorbing it. Therefore, for any healing of the wounds, any surgical wound, you need to have ingredients to heal it. And if you're not absorbing those ingredients through your diet, then that could be also a potential problem.
Yeah, both very important. Now, we stop our patients at least 2 weeks prior not using their injections or taking the pills if they're doing oral, to keep them from using these medications, because that gastric emptying is the problem. The stuff moving through and getting clogged up in the stomach. When we put people to sleep, as you guys know, we're putting a tube in to help control their breathing. That tube can sometimes tickle the back of the throat and cause a reaction. It makes you gag. And if you gag and you throw up, it can be a real problem. And so let's talk about some of the anesthesia considerations. That's one of the problems with Ozempic, but even further, there's kind of this idea, Pat, I don't know if you see this in your people that you see for consultation, but I see a lot of patients that think, I'd rather have it done under local anesthesia. What can I do under local? I'm scared of being put to sleep, but local seems okay. It seems safer. I mean, what could go wrong? What do you think of that?
Sure. Well, I think it's important to understand the concept that sometimes a lot of a very weak drug can be more dangerous than a small amount of a stronger drug. So for example, if you break your arm and you take 100 aspirin, your arm is still going to hurt a lot, but you're going to have problems from the aspirin. You're going to start bleeding and having other complications. Whereas if you broke your arm and you took 1 Vicodin, then the pain would be well controlled. So the same concept is here with local anesthesia. And so if you're doing one little area of liposuction, that's fine. That's okay to go ahead and do under local, because you're not going to overdose on the numbing medicine. But if you're doing multiple areas, and then that's typically what we find when we do BBLs and large body contouring, the amount of local anesthesia that you would have to inject can be dangerous. I think also very important is what you want your final result to be. Because many times we see patients come here into our office after having had liposuction under local, and they're not satisfied because they did not take out as much fat as they wanted for their final result. And so what happened in those cases, they started the procedure under local, the doctor did the best they could, the patient got uncomfortable, but they got to the point that they could no longer give any more local anesthesia. And so then the job was half done. So I think it's really important to talk to the doctor, be very frank with them, tell them, look, these are all my results. These are all my goals. I want to go ahead and achieve this. What is the safest way of doing this? And then you can talk about, the type of anesthesia and the setting where the procedure is done is very important too.
Yeah, that's a great point. I see a lot of that, people coming that have had, back in the smart lipo days, everybody was trying to do this stuff under local anesthesia, and it was even billed as being safer. But as we know, it's not really safer. And it's also, as you're pointing out, not very comfortable either.
Yes.
I always tell patients, look, local anesthesia is not perfect. And there are a lot of times where I could have a patient go either way. We could try to do this under local anesthesia. It's not going to be the most comfortable experience for you. Putting in the local anesthesia hurts. So when you're doing that, that's painful. Once it's in, then you're okay. But when we're actually doing the procedure at the edges of what we've numbed up, it's not numb. So as we're trying to shape things and really do a great job, you may feel a jab here, a jab there, and that's not a pleasant experience. And we all want our patients to be comfortable. We want them to have the best results. I think that can be done, with them sleeping. Kia, what are your thoughts on local versus general, and even in between? Because sometimes we'll talk about doing things under sedation, with people being basically, some people call it twilight, where they're awake, breathing for themselves, but not really awake. What do you think of sedation as an intermediate place?
I think sedation is great. I mean, Pat just highlighted a very important point that, there's a limit of how much numbing medicine we can inject a patient to get them comfortable while they're awake. Because there comes a point of, you have a patient who's feeling things that's uncomfortable and creates anxiety for the surgeon. Then you try to wrap up the surgery earlier. Then you compromise on the outcome. It just becomes a kind of a chaos. So I think sedation, an element of sedation, of course, with supervision of a good provider, certified provider, it would be another alternative. But all depends on also the level of complexity of the procedure and the level of comfort of the provider. I mean, I think it's very important that whoever is operating on you, he or she is comfortable performing under the situation. So if the doctor is comfortable with general anesthesia, you will trust your doctor, go with that. Don't request something that the doctor is uncomfortable with or they don't have much experience with. So I think there are many ways of, I hate to use the word of skinning the cat, but there are many ways of delivering the good outcome. It's a complexity, it's the comfort of the provider, the health of the patient. There are times when I may modify the treatment plan for the patient based on their health. So if they're not healthy enough to go through a long general anesthesia, then I may say, this is an alternative plan for you that requires less anesthesia. We can do it under twilight and it's safer, and you don't have to go through the whole anesthesia process. So I think there are different options. It's situation by situation.
Yeah, for sure. I think sedation can be great. I find that patients that I see frequently, they're more scared of anesthesia than they are of the surgery. And the truth is that anesthetic complications are more rare than surgical complications, which are already pretty rare. So, whenever there's a made-for-TV movie, I forget what it's called. It's got a one-word title. It's like Awake, or I forget what it's called, but you guys know what I'm talking about. It's a made-for-TV movie about someone having surgery, but actually being awake during the surgery and feeling everything and not being able to communicate that. And that drive, I just this week, earlier today, as a matter of fact, I had someone mention that fear, not the movie, but that fear. And every time that damn movie hits the screens, I got to answer to it for a week or two, as people still have it fresh in their head. the truth is about that, it's exceedingly rare, and I always tell patients we can monitor everything. We know your heart rate, we know your blood pressure at all times, we know your respiratory rate, how much oxygen's in your blood, and we might even be able to, if you have the equipment, you monitor brain waves. You can see their brain activity during surgery, and we can tell how awake or not awake you are that way. So there's so many ways that we know whether you're awake or not. We can tell. Not to mention that if you actually were feeling things, your body responds. And in fact, even when you're perfectly comfortable and asleep, your body responds. You know, if you're perfectly asleep and we do something that would normally hurt you if you were awake, your body reacts. Your blood pressure starts going up, your heart rate speeds up a little bit, and your body is responding to the stimulation of that surgery. So that's why, you know, the anesthesia provider is going to give you a little medication, going to calm things down, lower your blood pressure, increase the anesthetic to make you a little bit deeper into sleep. But all this stuff is really monitored. So I think, like he said, I think the best thing to do is to do what your surgeon's comfortable with, what he or she is recommending, and that way you're going to get your best results, and everyone's going to have a better experience. Kia, you mentioned a little bit about, you know, health status, of course, being important, how healthy you are to have something. One of the things that we see a lot of, it becomes a big topic of conversation, is BMI, body mass index. Now, BMI is a great way to judge the overall risks of a person having any procedure. The higher the number, the higher the risk, the greater the chance of that patient having some kind of complication. A lot of people use cutoffs, and mine is fairly generous. Do you guys use cutoffs for BMI when someone's coming to have surgery?
You know, in our facility, the facility has certain cutoff, like, you know, beyond certain weight, whether it's elective or non-elective surgery, they will not perform that. For elective surgery, I definitely have cutoff. You know, I always tell my patient, you know, this is an elective operation. I want to do it at a time when we can get the best results. And I encourage my patient, I inspire them to do the work on their own. And I tell them, I'm not giving up on you, but I want you to do these things, lose some weight, and you come back because I can get a better result for you. If you want to make this financial and time and, you know, life investment in this process, help me so I can help you. So I encourage them, and actually a lot of patients find that very friendly conversation, and many of them actually go and then come back a year later and say, hey doc, I listened to you and I lost 50 pounds and I'm not healthy and I can get better results. So yes, there's some, you know, it's not a black and white kind of a numbers I use, but for elective surgery, you know, 32 to 34, 35, depending on the size of the patient, is a good number I use.
All right, Pat, 32 to 35, what's your range?
We tend to go a little bit less than that. We do 30 to 31. And I think what Kia said is just the most important thing, that, I mean, really to listen carefully to what Kia said, that he is not, you know, as a reputable, ethical plastic surgeon, as a member of the Aesthetic Society, his priority is not just getting that procedure. I think the most important thing is that surgery, it's just not about the 2 to 3 hours you are in the OR. And that what Kia was saying was that he was establishing a relationship with the patient. He was communicating and really trying to understand how the surgery will fit in their life. And I think that's what patients should look for. Patients should look for a doctor that will do that. And, you know, trust your gut. Go ahead and make sure that you establish the relationship, because you want someone that will be with you beforehand, give you advice like a family member beforehand, have the expertise in the OR, but then afterwards to be with you as you're recovering to get your best result.
Yeah, that's really important. But obviously, it's a two-way relationship, right? And we all want to have the best result. We do as surgeons. Our patients, of course, they want to have the best results. Everyone involved wants to get them the best results. And Kia, like you said, I've sent patients away. I said, listen, really like to get you into a better place when you're ready to have surgery and heal better and have nicer results. And they value that, because that clearly shows, you know, we're not in it to see if the check clears. We're there to try and give you the best results, and if that means that we're not going to operate now or maybe ever, then that's the way it's got to be. And patients really value when you tell them, look, you're not the best candidate right now. You're my BMI cutoff is closer to Kia, actually above Kia. I'll go up to about 36. But it's not just about the BMI, it's about the overall health. I'd rather operate on someone that has a BMI of 36 but really has no health issues, is perfectly healthy, no medications, doesn't smoke, than to operate on someone that maybe has a couple of health issues, maybe high blood pressure, diabetes, and their BMI is 32. The number is only part of the story, but I think you do have to draw a line somewhere. And mine, I agree, is very generous, but there's more than just the number. Now, what also goes into that are habits, right? We talk about trying to keep people safe, but they have to keep themselves safe. And certainly losing weight is a good way to do it. Smoking, drugs, alcohol, all of that plays into the decision making of who's going to have surgery, what their risk is going to be if they enter it. Pat, what are your policies on drinking, for example, in surgery?
Drinking alcohol,
Yeah,
or
drinking alcohol. What are the guidelines for someone coming in? We're planning a procedure. What are you telling your patients about having some drinks over the weekend and they're coming in for surgery on Monday?
I mean, I think that I mean, you could have one glass of wine. I think that's okay. Really don't overdo it, because the couple days before surgery, you really want to prepare your body. You want to go ahead and you want your stomach, you want everything to be as empty as possible, simply because we do a lot of body contouring. Alcohol can really dehydrate you. And so that is counter to what we want to do. So we say, one glass of wine tops. I think that's fine.
Okay. Kia, you agree?
I agree for the most part. The keys he just mentioned was the dehydration. Also, the alcohol is metabolized by your liver. During the surgery, you're going to get medications that your liver has to process. And then after surgery, you're going to take medications like Tylenol and other things that your liver has to process. So essentially, why load your body on things that you don't need when you need the whole body focus on healing process and processing all the medications you're going to get? So I think that's very important. And also, from a bleeding viewpoint, red wine has been shown to contribute to increased risk of bleeding. So I want to make sure that my patients do not drink red wine, just like aspirine.
Yeah,
for
well,
a week
that's a great point. Now, marijuana is legal in a lot of places.
You were the first.
Yeah, listen, I don't think there's anything wrong with it. I tell patients, I take histories. I always ask about this stuff specifically, and I ask, you drink, smoke. I ask about marijuana specifically because if you can't say smoke, you say, do you smoke? Oh, no, I don't smoke. But you ask them about marijuana. Oh, sure, that. And using marijuana could be edibles, could be smoking. So, you're coming from the land of legalized weed. And how do you speak to your patients about that? Because it has some very important implications leading into surgery.
Yeah, it actually interferes with the anesthesia. My anesthesiologists have told me that they have to stop 2 weeks before the surgery any form of CBD intake, whether it's inhalation or ingestion. But yes, we stopped that. And I think one of the side effects of marijuana that we are learning more and more is it slows you down. It slows down your internal energy flow. If you believe in energy, it's the worst thing you can take. So I don't believe in marijuana as a long-term remedy for a lot of issues, but I think around the time of the surgery, it's good to stop it for 2 weeks before, because it does interfere with the anesthesia and the wake up from the anesthesia.
Yeah, for sure. Pat?
Absolutely. I think you also have to be very careful as to what type of marijuana, what type of marijuana or THC ingestion, because sometimes when people vape, they might be vaping with marijuana with a THC that's mixed with nicotine. And so nicotine is a real big enemy. And so then that's what we really want to avoid. And so if people are doing that, I often say, let's just be safe than sorry. I mean, please go with another form. We really want to avoid nicotine.
Yeah, well, I have them avoid smoking it completely, whether it's marijuana or tobacco. And then after surgery, I don't particularly mind. Once we get past the anesthetic risk and they're over the hump of surgery, if somebody wants to use edibles, maybe it gives them some pain relief, and it does calm them. Maybe they're anxious and it helps keep them calm, helps them sleep, what have you. I let my patients use edibles a day or two after surgery and moving forward, but I don't want anyone smoking anything for 2 to 3 weeks before and after, and that's what I tell my patients. But now smoking is not just the only issue. Now we've got vaping. So vaping is it's not. People think, oh well, I'm not smoking. I'm just vaping. That's not bad for you, right? I'm okay. What about vaping, Pat?
I think it's really, you have to be extremely careful with that because exactly what you said. Some people think that this is not smoking. And it's true that it may not have some of the carcinogens that tobacco does. But again, it's all about the nicotine. And so what we do is that for patients that vape, we ask them to go ahead and take a cotinine test. And the cotinine test is a very simple urine test that really checks the level of nicotine in your blood. And if the patient has a positive test, then we ask them to delay their surgery. Because really, by avoiding this, you are preventing a lot of problems. And we tell patients that this surgery, not only is it a change in your life, but it's a big investment. So you really have to protect your investment. So make sure that you go in surgery as clean as possible, but then take care of it afterwards. And just like you said, once the patient is fully healed, they can restart these things. But this is a very critical period, the wound healing
Yeah, I mean, you have a
process.
small window to get better. Kia, vaping, you seeing a lot of that in Oregon?
Yeah, we do. I think just to build on what just Pat said, beside the healing aspect of the or retardation of the healing that we see with nicotine in your circulation, there's also a problem with the airway irritation.
Right.
So a lot of these patients will be coughing. The smokers are coughing. So coming out of anesthesia, they'll be coughing harder. And especially if you're doing anything with the face where, bleeding is an issue along the eyelid surgery, definitely I don't want any patient coughing, waking up. So in fact, I always tell my anesthesiologist, wake these patients up a little slower and deeper so they don't have any airway problems. So that's one of the other reasons to stop any vaping or smoking.
Yeah, we do a deep extubation on most cases, especially facelifts, where the worst thing you can do is increase the pressure in your head. You start coughing, you're hacking, you're struggling, and next thing you know, a little vein that was otherwise not going to cause any trouble, a little bit builds up and a little clot pops off, and you've got a hematoma, a little bleeding underneath the skin. Now you got to go back under anesthesia, clean that out, make sure they're safe, and it's not a great thing. So we do a lot of deep extubations in my practice to try and keep people calm, let them come up nice and slowly, let them breathe for themselves, and I think they actually have a more pleasant, immediate post-operative experience that way too. Uh, we have been talking about all the things that patients can do to help themselves, that doctors can do to help themselves and keep safe. And sometimes doctors are just not doing the right things. And as I know, it's a patient safety episode, but sometimes the best way to keep patients safe is to make sure that certain doctors are not doing what they've been doing. So this is a touchy subject, especially for us as surgeons. The question is, when do you think it's the right time to take away a surgeon's right to practice? What things can happen that are egregious? And what are the things that doctors can do that cross the line so far that licenses need to be revoked? Kia, you're the president of the Aesthetic Society. You ultimately, at this point, preside over ethical and judicial decisions that have to be made relating to the society and the members therein. What, in your mind, crosses those lines?
There are many different levels of violation of trust, violation of ethics, and then there's also levels of abilities. So it's not just the ethical violations or somebody who has poor judgment on repeated cases, but also there's a level where unfortunately it's going to happen to all of us, where we are no longer able to perform surgery. So we see it in our own communities where more kind of the group of more junior surgeons have to go up to tell the senior surgeon that it's time to hang it up.
Yeah.
And it's a tough conversation to be had because it will happen to all of us. But it's one of those things that you have to, as for the good of the patient's safety, you have to take that step. So that's on the side of a doctor who's done a great job, but it's time to hang it up. It happens in every profession. Like pilots can only fly for so long. But then there's a violation of ethics. Something recently came up in front of the board, and we got together with our colleagues at ASPS, and we sent a letter to the doctor saying, knock it off. and what you're posting is unethical. If you see, then you have also every state has its own board, medical board that looks at these violations. So if there's a violation of patient trust, harassment, complications that shouldn't happen on a repeated fashion, all of those things has to be looked at case by case, which is why we have medical boards, and ultimately the medical boards in this each state make the final decision what to do with that specific doctor. So it's a tough situation, but at the end of the day, we are all in this business and responsible for patient safety.
Correct.
Yeah.
Yeah, I mean that's exactly the point. That's why this episode to me is so important. Is so it really hit it close to my heart, because throughout my career I've tried to do things like calling out doctors that I think are being disingenuous, people practicing outside their scope of ability. You speak about ability, you really need to know your own limitations. And when you have a pediatrician who decides, liposuction looks easy, I think I'm going to do a little weekend lipo course, and maybe once a week I'll go do some suction and make some extra cash. It's probably not the most ethical choice to make, because you're not truly prepared to take care of the patient. I mean, all these things come into it. It's just so hard to say when a doctor has crossed a line sometimes. And you're right, sometimes they're not crossing a line. It's just time to let it go. All right, well, we're talking about a lot of serious stuff, and it's time to lighten it up a little bit. I think we're gonna start a segment we call Two Truths and a Lie. Now, the way that this works is we're gonna put up three different things that I've asked both of you to come up with different things. I'll start it off because I have there's two sets of mine, so I'll go first. Then we'll have you guys present your three stories. And the people who are not presenting it, so I'm gonna go first. You guys have to decide which of these things is true, and which one. There's only one lie. Two of these are true. One of them is not true. So you got to see some of the crazy things here and see which one is truly the lie. Okay. All right. So let's go ahead and get started, Joe. Let's see what you got lined up, and I'll go through my stories. Fingertip exchange. This is when I had a call from a patient that I actually spoke to on the phone prior to their consultation. They were calling with an interest. And the patient said, I just joined this group, and they're asking me to have all of my fingertips removed and to get skin grafts on all of my fingertips. And I said, that's interesting. And I had a little conversation with the guy, and I made him an appointment. So I actually had a patient that wanted to change all of his fingertips for skin grafts. That's the first story. You've decided that's true or not. Next one. Yeah. Okay, so many years ago, there was a technique of stacking breast implants where you'd put actually two implants in, one on top of the other, because years ago you didn't have the variety that we have now, all the shapes and sizes. So if you wanted to get extra projection, a lot of doctors, a lot of surgeons would put one implant on top of another. So I was once doing a revision, an implant exchange, and going in to take out the old implant, putting a new one in, refreshing the pocket, reshaping the breast. And so to my surprise, I went in and there wasn't one implant on each side, there were two implants on each side. So I did an implant exchange where I actually removed 4 implants instead of 2. And so that's the second one. And the third one, there was a trend years ago where people were getting body modification surgeries. And I did have a patient come in that asked about having her ears made into Spock ears, the pointed ears that Vulcans have from Star Trek. And when we had the consultation, I had to think of ways. It's sort of like an old board question or an interview question. Someone would ask you if you had to make this weird thing, how would you make it? It's how we interview people thinking about going into plastic surgery, coming up with creative ways. But there I was. She said, I want to do this. It's something I've seen done. And there was stuff, of course, in social media promoting it. And I said, well, we had a conversation. Well, this is what it would take to do that, but it's not reversible. So I did have someone come wanting to become Spock by surgery. So those are my 3 stories. Which one, Kia, you're up first. Which one of these do you think is not true? Which one's the lie?
I think the Spock one is a lie.
You're going with Spock?
The implant one I've seen it myself, so I believe it. The Spock one, I don't know. I mean, but you guys are in Miami, so I don't know, anything's possible. We call that wild, wild east, so anything's possible in
It's
Miami.
true. It's true. Pat, what do you think?
Wow. Well, Adam, you and I both trained in plastic surgery in Houston, and this is really where they invented this procedure of stacking implants. And in fact, Anna Nicole Smith reportedly had 4 implants, and I happen to know the surgeon who did that. God rest both of them.
Yeah.
I think the issue with plastic surgery, it's so crazy that all 3 stories sound really, really believable, but I will go. I think the 4 implants is absolutely true, and I'll go with the fingertip exchange that was not true.
Okay. Well, Joe, you want to reveal it? Actually, the one you guys thought was the real one is the lie. The 4 implants, while yes, it does happen, I personally have never had a case where I took out 4 implants. But the fingertip exchange was absolutely true. I made an appointment for that guy, and as soon as I made the appointment, got off the phone, I called the local FBI office, and they had agents staged in my waiting room. I didn't know who they were. They're just people coming in and out. They very discreetly had agents staged in the waiting room, in the lobby, waiting for this guy to show up, because clearly this is some I'm avoiding being detected by changing my fingerprint type of thing. And the Vulcan ears, yeah, that happened. It was a thing for a little while. So there's mine. Okay, so Joe, who do you got next? Who's up?
Pat?
Sure, Pat. Let's go ahead.
Sure.
Cue up his truth and lie.
So
Go ahead, build it up, just like we did.
Okay, so here's the first one.
Okay, so 4th tummy tuck. Go ahead.
Yes. So my first story is I had a patient who I actually performed her 4th tummy tuck, and she came in. She had 3 tummy tucks before. They had not achieved her results, and I went ahead and performed her 4th one. So that's my first story.
Okay, 4th tummy tuck. What's the next one, Joe? Rib fracture, tiny waist.
Yes. The second story is that one procedure that I do commonly is to go ahead and change the shape of the ribs to actually give the patient a smaller waist. So that's my next possible story.
Okay, and third, let's see. Motor oil in the butt.
Yes. And so my last story is I have patients where we went ahead and we took out 4 pounds of motor oil in the butt, and after that we immediately went ahead and filled the butt with her own fat to go ahead and reconstruct that.
All right. Well, there you are. We've got doing the 4th tummy tuck, breaking ribs to make a waist thinner, and finding motor oil, doing the oil change in the butt.
The oil.
What do you think, Kia? Which one is the lie?
Gosh, again, I don't know you guys from Miami. I guess I don't think the motor oil is the true story. I hope not. I think that's the lie.
Yeah, I'm gonna have to agree with you. The 4th tummy tuck is pretty far-fetched. If you're a plastic surgeon, you understand. Every time you do a tummy tuck, you're removing so much tissue, making it so tight. I've done the 2nd one for someone. I've never even done a 3rd one. So the 4th one, that's a lot. But hey, I believe it can happen. Rib fracture, yeah. I mean, it's a kind of a new procedure, but it's something that a lot of people are trying to do now, and the results are actually pretty impressive. Motor oil, yeah. Well, I'll tell you where you lost me on the motor oil story is, could you find motor oil in it? Hey, listen, that was in the news years ago. I mean, they had oil, they had concrete, they had Fix-A-Flat, all kinds of crazy stuff in the butt. But when you said you regrafted them right away to put fat in there to make it better, yeah, that's not going to happen. So I'm going to go with the motor oil. I'm with Kia. What do you say, Joe? Yeah, there we go. All right, so we got it right. But the
Yes.
4th tummy tuck, 4th. Wow, man.
Wow.
Absolutely. I mean, she started with a small tummy tuck that was done by her OB-GYN, and then she went and had a mini tummy tuck, and then she had a reverse tummy tuck, and none of the problems were being addressed. And so I think that's also what makes plastic surgery so interesting and so challenging, that we as plastic surgeons, we're not taught how to do one set of procedures. We're taught how to do techniques, and we can go ahead and modify these techniques as the specific patient understands. So that's what we went ahead and did there. As you said about the rib fracture, it is a new technique, and it's really powerful, and it can get beautiful results. And you really nailed it on the head, with the motor oil. That here in Florida, we have seen silicone, industrial grade silicone. We've seen lard. We've
Yeah.
seen Fix-A-Flat, all of that injected. But the key word in my story was immediately. And you're absolutely right that when you do this, it has to be done in 2 procedures. You can't fix something just once.
And they're going to be messed up for a while. That tissue's going to be nasty. So hey, man, God bless you. If I ever see anyone with motor oil in their butt, Dr. Pazmiño's excellent for these kind of things. I know he's great. All right, Kia, you're up. Let's see your stories. What do you got, Joe?
Well,
All right, so dentist. Here's your first
my
guy.
first story is that I wanted to take care of all my patients' problems, so I also became a dentist. So they have one-stop visit for everything that they've got, so I can do all of it, from root canal to tummy tuck to facelift. I can do it all.
How
That's
about
my
that?
first story.
Okay, what's the next one? Let's see.
Second story, I watched that Free Solo movie and I became so inspired by the guy that I took on climbing, and now I've become an avid climber. You can see all these things on my fingers. So I became an avid climber. And the third story is I'm just a crazy guy who is into fitness, and I do Ironman races.
Okay, so Pat, you're going to have to make the choice. Is Dr. Mavasagi also a dentist and takes care of dental problems? Does he climb? Is he a mountain climber and do rock climbing? And is he actually an Ironman aficionado?
Yeah. Wow, this is really hard because, from what I know about Dr. Mavasagi, he can really do anything. So I believe all of these stories. He's the Superman of our society. I've seen Dr. Mavasagi go ahead and jog in some of the most beautiful cities in the world. So that being the case, I'm going to say that I do believe that he's an Ironman. Absolutely. In terms of the dentist, I don't think he's a dentist. I think he's an oral surgeon, where at least he has that training. So he's one of our best trained surgeons. So that being the case, if I believe those two, I'm going to pass on the climber story, even though I think he could do that.
Yeah, well, I'm thinking the callus he's got is from doing a lot of liposuction, maybe. That's kind of building it up. So, mountain climbing, I can believe. Kia is in fantastic shape, and I've seen the same posts on social media, him all over the world, running, cycling. So the Ironman, for sure, I believe he's participated in a couple Ironmans. I'll buy that. Dentist, we know he has credentials. So are we playing semantics, dentist versus oral surgeon? Maybe. At mountain climbing, for sure he could do it. And it's not that far-fetched to think that he's a big fan of it. I used to take my kids rock climbing, so it's not that hard to believe. So I got to choose. Okay, dentist or mountain climber? Pat, you're saying semantics. Dentist. I'll say he's not climbing mountains. I'm gonna go contrary to pick that. What do you got, Joe? Where are we? Yeah. Oh, there you go.
I am the farthest away from mountain climbing. If I see a cliff, I freak out. You have to call a helicopter to get me down. I don't mind going up on the bike, but if I see a drop off, I freak out. I get
So how are you getting down? Well, first of all, what is the point of going up all these paths? Because you're probably like in nice flat ground when you're on the bike, maybe uneven, but not so much up a mountain.
No, the elevation doesn't bother me. But if I see a drop off, the bottom of a mountain, I freak out. But if I'm on a road, I can climb any mountain. That doesn't. So yeah, I've done 2 Ironman. I am a dentist, and but I'm not a climber.
Okay. All right. Well, I'm going to round it up with my last set. See if you guys can do better on this one, because I fooled you both on the first one. So here's the next one. Not just once, but a few times I've had patients come to the office and say, "Hey, doc, I got this filler. Would you mind injecting it for me?" Like bringing a box of filler to the office. Yeah, maybe give me a break. I just want you to inject it. I'm not going to use your filler. So here's stuff I got somewhere else, and I want you to put the filler in. That's story number 1. Story number 2. Oh yeah, I a twofer, huh? I had a celebrity patient that was pregnant and was scheduled for a C-section. So she knew the date she was having a C-section, and she called and said, "Hey doc, I don't want to waste any time. I have a scheduled C-section on this date. I want to do my tummy tuck right then." And that was a real request from a celebrity patient. Okay. and oh yeah, this, I don't know if this ever happened to you guys. This is awful. To be in the middle of surgery and you have to stop surgery because a fire alarm goes off and you have to evacuate the building. So you cannot continue surgery because the fire alarm has gone off at mid surgery. And this actually happened in a facelift. So had to cut a no pun intended, cut a facelift short and stop and have to resume it another day just to comply with the evacuation orders. So got those three things. You guys choose. Which one is the lie? I think, Key, I made you go first last time. Pat, you got to choose this one.
Wow, those are really tough. Those are very believable. Very believable. Of those three, I'm going to say the second one about doing the tummy tuck at the same time as the C-section. I hope that's the lie. I hope that seems to be the most unbelievable. So I'm going to go with that one.
Kia?
I think, I mean, the second story was the patient requested, so I can see the patient requesting it. I don't think you did it, but so if the patient requesting it, I think that could be truth. But you wrapping up a facelift because of a fire alarm, I don't think that's true. I think you continue unless there's a fire. You continue operating. I don't know. I think that would be the third one. That's the lie.
So you guys are both buying the bring your own filler. That one you guys believe is true.
Yeah.
I think the patient would do it, yeah.
Okay.
Yeah, that's
All right.
happened to me.
All right,
Yeah.
Joe, is that you too? Well, Kia, you got this one. I would never stop surgery unless there's a true actual emergency. This did actually happen, not just a fire alarm, but I've had it happen in a facelift where the power went out, and I was in a hospital, and the backup generator did not come on. We were preparing us to. I had to do a temporary closure, cover the patient, keep them under anesthesia. We were in an ambulatory surgery section of the hospital, and we were going to wheel the patient to the large OR to continue in the main OR. And thankfully, after a fairly short period of time, about 20 minutes, half hour, I kept operating. We were operating by flashlight because all the lights were out. Even the backup lights were not light enough to see in order to operate. Anesthesia had backup power in the room, so that was working. But yeah, I didn't have to stop surgery, but it's happened to me with a power outage and a fire alarm. So you got it right, though. I did not wrap the operation up. We just kind of powered through, no pun intended. So there you go. That's two truths and a lie. So we're kind of coming up to the end of the show. I want to go through the must-haves. These are things that, people watching, if they're going to look for things in a plastic surgeon, in choosing a procedure, in a facility, give me your top three must-haves if they're going to move forward and have a procedure. What should they absolutely be looking for? Kia, why don't you start us off?
I think it starts with the credentials. I mean, you want to do a background check of your surgeon, who you're going to go with. I mean, if that patient, the doctor doesn't pass the test, don't go with that doctor. So number one, credentials, make sure they're board certified. You can check their background if there's anything against them, any major lawsuits. Number two is when you visit the doctor, you must trust your doctor. It's very important to watch the whole process from the front office, how they run their office, and how the interaction with the doctor goes. Because a lot of the times that's a representation of how that practice is functioning with the well-run machine, because the reflection of the doctor. And I would say number three is before and afters. Look at their website, and do they have before and afters? If the quality of before and after is not good, you see that there's no consistency between the picture. One picture, the underwear is down, the other one, the pants is down. That's a red flag for me. That's how I would know if somebody's a good doctor or not. If their picture is not good, I don't trust them.
All right, Pat, what do you think? You got a unique three to add?
Absolutely. I mean, I agree with everything Kia said. I think that's terrific. What I would say is, understand. I think what patients have to understand is that they deserve a good result and they deserve a good experience, and they need to protect themselves, not just them, but their whole family. I think that's incredibly important. So what I say to patients is that you're having plastic surgery, so it should be done by a plastic surgeon. And so we recommend patients go to this website called checkyoursurgeon.com. There, they can put in the name of any doctor in America, and they can find out what the doctor's actually trained to do. So if you're getting plastic surgery, it should be done by a plastic surgeon. It should not be done by a general surgeon, by an OB-GYN. You don't deserve that. Go ahead and really check the credentials. I think that's number one. Number two is really understand that you are going to need support before and after surgery. So like Dr. Movasagi said, really see how you feel. Patients should trust their gut and see if they have good experience with the office as a whole. And then finally, the last thing that we talked about, whatever procedure you're having, it can be safe to be done outside the hospital. But remember, hospitals cannot be tricked. So if you're considering something, ask the surgeon, please give me the phone number of the hospital that would let you do this procedure safely. And if they won't provide that, or if there's not a hospital, you've really dodged the bullet.
Great advice. I mean, all these things are very important, making sure you're keeping yourself safe with properly credentialed. The running theme here is properly credentialed doctors and facilities. And you can trust that a hospital that's accredited is a good place to have it done. If a doctor cannot operate in a hospital, it should raise some red flags, and make sure that that doctor has the right credentials. And to that end, Check Your Surgeon's a great resource. I always tell patients to go to certificationmatters.org. Joe, why don't you pull that up real quick? Certificationmatters.org is just a way to check that a doctor is actually board certified in something. And to Pat's point, make sure that they're board certified in plastic surgery if you're having plastic surgery. You don't want the pediatrician that's doing liposuction once a week to make a little extra scratch. You want to make sure you're seeing someone that does this every day, all day, and that he or she is properly trained, that they have proper board certification by the American Board of Plastic Surgery. Pat, earlier you were mentioning some of the other boards that people claim to have that are just not to the same standards. They're not recognized by hospitals, and people can't get privileges using them. So the American Board of Plastic Surgery is the only board that trains plastic surgeons in the United States that is, to certify board certified plastic surgeons. And so that's what you really need to look for. We'll never get through all the things that we could talk about with patient safety, but I think we chopped a lot of wood today, guys. I think we got through a lot of important things. Anything that you guys think that we should bring up before we wrap the show? Something like a parting shot you guys think is important for people?
I mean, I think, it's nowadays people come to our offices not just for surgical procedures, but also other non-surgical procedures. So it's equally important for the folks to make sure that whoever is delivering the non-surgical procedures, they're also well trained. As a matter of fact, in the Aesthetic Society, one of the new category of membership that we've created now is called Ally Pro, which just stands for Allied Professional. And what we try to do is that we try to take on the folks who are getting their education from not necessarily the most trusted source and bring them in-house and train them and provide them with the same kind of a education that we, the surgeons, have been accustomed to for many years by going to the Aesthetic Society to get the education. So now we have the Ally Pro who can come to us and get educated by the best faculty in a trusted fashion so that they can go out and deliver the best and safest treatment to their patients, because we all need to improve safety. That's our mission at the Aesthetic Society.
Yeah, for sure. And I think that has been really revolutionary, is to look at the team, not just the surgeon, but everyone involved. Whether my PA is a member, my surgery coordinator is a member, someone that stays involved in society and educates themselves with the publications the society puts out, the emails that come out, trying to keep people really up to date and current. Pat, your parting shot.
Well, I would just like to second and triple what you said, that a lot of this homework has been done. And I think patients really should understand that they deserve a great result. They deserve a great experience. And that really is what the Aesthetic Society is about. So if you go to the Aesthetic Society, you can go ahead and find a surgeon that will treat you like family, a surgeon that is ethical and well-trained. And not only that, if you're interested in a nurse injector into a PA, you will find providers that meet up to those same high levels. So protect yourself, protect your family. Plastic surgery should be a very positive, life-changing effect, and we're all here for you.
Yeah, well, that's why I do it. It's the impact it has in people's lives, and I think we all do look at our patients as extended family. You know, I always tell patients I don't give them advice that I wouldn't give to my own wife or my sister or my brother. That's the way I look at it. I know we all feel the same way, and it extends also. You know, we're talking about the staff and the support staff, your extenders, the PAs, nurse practitioners that represent the practice and also take care of patients. We build a culture, and when from the top down we're held to high ethical standards and have to deliver the best results in the safest manner, we impart that to everyone that's working in our team, and you build a culture that's interested in giving the best results in the safest manner. So, tremendous hour that you guys have spent with me. Thank you for giving me your time. Appreciate you coming in and joining us in Naked Beauty. I want to thank Dr. Pat Pazmiño, who I'm now going to call Pazmiño for the rest of his life, and get it correct for the rest of the time. Pioneer in patient safety, particularly BBLs, an excellent plastic surgeon. Dr. Kia Mobasagi, excellent plastic surgeon, and as we learned today, dentist. So next time I have a toothache, I'm calling you to get some advice, man.
I may have to watch a YouTube video to learn how to do it. Remember?
No. Hey, listen, in Miami, that's how a lot of this stuff gets done anyway. People are just watching YouTube videos and open up in a practice, so why not, right? Dr. Mobasagi, president of the Aesthetic Society, has been an icon, just a contributor in the world of cosmetic surgery and the Aesthetic Society specifically for many years, now ascended to the presidency of the society. We could not be in better hands. Thank you all for joining me on Naked Beauty this episode. We'll be back in October with another episode, and we're planning possibly a special episode to continue the patient safety theme. You just watch at Naked Beauty TV and at Dr. Rubenstein social and the story and the feed for information coming up about that next episode. This is another good one about patient safety, and you're not going to want to miss it. Thank you for joining me. We will see you next time on Naked Beauty Live.